Hey everyone, my name is Claudia, and today I'm going to be talking to you about orgasmic disorders. So, to start off, what is an orgasmic disorder? This is usually the person's inability to reach orgasm during sexual intercourse or sexual interactions. Both men and women can be diagnosed, and symptoms must usually occur 70 to 100% of the time during the activity for at least 6 months. The female orgasmic disorder is when an individual has difficulty reaching orgasm even when they're aroused. The orgasm experienced via clitoral stimulation does not meet the criteria. This disorder is the second most common sexual difficulty after low sexual desire, and 30% of women reported not reaching an orgasm in their most recent sexual encounter, while 10% reported they never had one at all. Some physical causes could go from medical conditions such as diabetes, heart disease, and neurological disorders. Age, spinal cord injuries, medications, inadequate stimulation, and drug use can also be a problem. Some psychological causes of the disorder could go from fatigue to stress, ineffective sexual behavior such as misinformation in communication, sexual anxieties, fearfulness, conflicts with self regarding sexual guilt and negativity. Social cultural factors such as gender roles and expectations and religion can also be part of the problem. Some dysfunctions in treatments. Although each person has their own conditions for that they consider to be good, lower expectations and adaptations could be helpful. Mirror examination, body relaxation, masturbation, sexual voice, and exercises could be of help. Some more specific treatments would be discussed with the doctor. There's also the option of counseling and sexual therapy and switching medications. The male orgasmic disorder is the inability to achieve orgasm despite lengthy sexual contact or while participating in sexual intercourse. It is usually they experience delay in orgasm or unable to experience orgasm altogether. Some physical causes may relate to the body. There's also spinal cord injuries, strokes, and multiple sclerosis, and substance abuse. Some psychological causes of the disorder can go from depression, anxiety, guilt, anger, stress, self-esteem, and trauma. Some dysfunctions and treatments are usually a psychological approach which involves recognizing such problems, such as depression, poor arousal, anxiety, or fatigue. In most cases, a combination of psychological and physiological approaches to resolving the orgasm dysfunction make the most sense. Keeping a healthy lifestyle with a nutritious diet and exercising can also be of help. Premature ejaculation is a continuing pattern of ejaculation during sexual activity before individual desire. This is one of the most common difficulties for men. Some physical causes could be diabetes, alcoholism, and smoking, which has been linked to 50% of the erectile problems for men. There's also diseases, spinal cord injuries, and in some cases, heart and circulatory system problems. There's also psychological causes like sexual abuse, poor body image, depression, worrying, guilt feelings, and stress. Dysfunctions and treatments. Treatments are not usually needed, but for some men, stopping or cutting down their substance abuse can help. Practicing relaxation techniques, learning to identify and control their sensations, communication, and counseling. Some possible tricks go from the stop and start technique, the squeeze method, and the lower position. Retrograde ejaculation is when instead of the semen being ejaculated, it is redirected to the urinary bladder. This is usually not harmful, but it may cause infertility. Some physical causes go from some medicines and drugs. There's also surgery such as prostate and diabetes and nerve damage. Dysfunctions and treatments, though this doesn't usually require treatment unless it interferes with fertility. In most cases, a fertility specialist may be able to help. There's also switching up medications that could help with the person's inability to ejaculate.